want to see. I understand recording's in progress, so therefore I'll step further away because the older I get, the better I look from a distance. So since we're being formally recorded, just briefly in looking at the gallery speakers, has anyone here had the opportunity to have oral rehab services? Just a show briefly of hands, or some of you, yes. Hi, hello, Russ. Russ has been a leader and received oral rehab, as well has been a fabulous advocate. Let's talk about why. Why would it even be needed? Shouldn't your hearing aid or cochlear implant be sufficient? And in a perfect world, if all of your communication is done in person, close up, in quiet, without multiple people, in that unique situation, perhaps the hearing aid or the cochlear implant would be sufficient. But that is not the way life works out. It's complicated. You're meeting with people in groups. There's noise at a distance. And given all those situations, this is where my PowerPoint just got stuck. What can it do for you? The purpose. There's an echo. Lisa, someone has an echo. What we are here to talk to you about is what can it do for you? It can help you adjust, maximize the benefit that you get from your hearing aid or implant. And as we learn from our clients, I believe Russ Mishaloff made this point to us, that it takes time, it takes effort, but it can make an important contribution to improve your communication skills in your daily life. To myself and my colleagues, Diane and Antoinette, we know that the real end result, the most important part, is the difference it can make in the goals that are important to you. Each of you may have a similar degree of hearing loss, but the impact it has in your personal life is very different. For one person, it may be the difference that the rehab can make for how you can function in a meeting. For another, it's the ability maybe to hear your grandchildren. For another, it's to be able to have the independence to be able to handle the calls for your doctors or your financial needs. Many years ago, I had the privilege of being a faculty at, it's now called Rhodes Scholar. Was called Elder Hostel. And people would come for a week and to learn about hearing loss. And they often came with their significant others. And many of them were at difficult turning points, let's say in relationships, where there was one man who said, I need to be able to be independent to make calls to my financial broker without always having to depend on my wife. And I know for those of you in the audience now who may have a husband, wife, daughter, son who's there, they have been troopers, they've been saints in supporting what you need. At the same time, it's also wonderful to see to the extent that you're able to maintain your own independence, to be able to take care of what's important for you. So what is it? We've had the privilege of working, as they say in the movie Band of Brothers. We're not heroes, but we're privileged to have known and worked with those who are. Arthur Boothroyd is a key name in the field of oral rehabilitation. And as part of the RERC, no, Lisa, we won't make you say the name again. Dr. Arthur Boothroyd has been part of the research team. And he is someone who's often quoted by researchers, clinicians alike. He defines oral rehab as the reduction of hearing loss, induced deficit that causes deficits in your function, and then particularly activity participation, which you know about the activities that are important in your life, quality of life. And this is achieved through sensory management. That refers to the sensory management is hearing aids, cochlear implants, instruction, which is how to get the most to work with that, perceptual training, auditory training, speech reading training, as well as counseling. So most recently, the American Speech Language Hearing Association, which is referred to as ASHA, put together a multidisciplinary panel of professionals, including your very own Lisa Hamlin, here's a shout out to you, Lisa, to run a systematic analysis of over 70 studies with evidence-based interventions of adult oral rehabilitation. And my co-PI, Professor Brewer, we were privileged to be invited to submit the results from our clinical studies as part of the meta-analysis. Basically, what has happened over the years is clinicians see the benefit of providing oral rehab anecdotally, in working with clients, but what's needed at this point, and what they saw was needed, was evidence-based studies to guide clinical practice. So this was just published in their American Journal of Audiology in November 2022, which is just a few months ago. And they came up with a new clinical practice guideline about oral rehabilitation for adults with hearing loss. The most important thing that ASHA concluded was that oral rehab should be considered essential and made available to all adults with hearing loss. And I know there's probably questions in the audience at the end of why isn't this the norm and what can be done next? And we will try to address that after we present. So also there's one of the leaders in the field of oral rehab, but certainly not the only one, Dr. Nancy Ty Murray, author of a rehab textbook, recently posted to have adults with hearing loss who would ask, well, what should you expect from oral rehab? One aspect is counseling and strategies, a home practice program, getting the most from your hearing aids, cochlear implants, and other assistive technology. Where to get it? Audiologists or ENT will make recommendations, more often audiologists. And then there are databases on American Speech Language Hearing Association called ProFind, and also the American Academy of Audiology. Does insurance cover it? There you'd have to contact your insurance provider to find out. Medicare does cover oral rehab. There's a certain code for it. What we're here to tell you is what we've experienced with our clients over many, many, many years is that oral rehab is an invaluable tool for people with hearing loss to maximize communication and your listening skills. So the goal of AR therapy, as noted by Dr. Arthur Boothroyd, is reducing the impact in your daily life. And how is that accomplished? The American Speech and Hearing Association delineated 4 key components of oral rehab communication therapy. Before I go further, Lisa, am I going too fast for the captioner, or is this okay? Just checking. Is it okay?
Hello?
Yes, is it okay, or am I going too fast?
No, you sound fine to me.
Okay, just wanted to check. So in terms of the components, they looked at in their research from the meta-analysis about informational counseling is one key component, perceptual training, personal adjustment counseling, and what's called multi-component AR, which combines all of the above. Their meta-analysis, so you're hearing the results in the most recent guidelines, is that every aspect provided additional benefit. ASHA recommended that you receive at least one of the 4 approaches. What AR therapy approaches are chosen, it's based on a shared decision-making, which considers your individual needs, abilities, goals, and preferences, whether that's done in person, whether it's done remotely over tele-AR, and also depends on where you are now. It could be when you first received your hearing aid or your implant, you're at a certain level of function, and your goals were, you had certain goals at that time. But your life changes, your communication, the demands change. And so that evolves and adapts over time. And therefore you may have new goals for situations that you're in now, and what can be done in the way to meet the challenges you have in your everyday life. So what are the components of communication therapy? Informational, which includes counseling on your hearing aid and implant controls. This is not insignificant. You can be brilliant in one area. We've had lawyers, professors come in with their box of components, let's say from their cochlear implant, and not able to know how to interface with the telephone, because you're mixing a lot of the technology is changing rapidly. There's a lot of different interfaces, whether you're using Mac, you want to stream something, there are updates, and a little bit of extra support and training and the time that's needed can go a long way, including hearing assistive devices, when to use it, what works for the situations that you need. Training on the telephone. And it's not just one way to use the phone. We've had clients where they're comfortable to use the cell phone, whether it's with family members, in calling to, let's say, a doctor's office, they need a direct connect and they would use a different phone. So it can be complex. Perceptual training, which consists of auditory training, speech reading training, clear speech training. We may just identify that today, but there'll also be a handout. We have a number of additional information handouts that can help you. Personal adjustment training, that includes communication strategies management, and we'll go into these further, and counseling with significant others. And then multi-component that puts all of this together. The goal is to help develop and improve your listening and looking skills in multiple situations, ranging from general communication, family, friends, work, school, telephone training, in background noise, restaurants, meetings or group activities, business, movies, theater, travel, which you just mentioned. You'll have a webinar on that in a few weeks. That's a major new thing. Exercise, classes, safety. This slide gives an array of some of the key goals that have come up that we've experienced recently with some of our clients. Even with the best hearing aid fitting, cochlear implant fitting, we've had clients who expressed that one of their top goals is even 1 or 2 people in quiet, hearing their wife or son better during dinner, understanding neighbors. And as you can see on the right, even though here over Zoom, we're not wearing masks, but even though a lot of that has changed in the environment, it will still be true when you're traveling. It's still true with doctor appointments. It's still true when you go to the supermarket. And it becomes very difficult to navigate, especially when you rely on a combination of listening and visual clues to be able to see someone. In noise, hearing your friends when you meet at church and background noise, a book group at a restaurant. Other examples, obviously, we had someone to hear his son and friends from the sports team when they talk together in the kitchen with lots of noise, and on the phone to hear your grandchildren, which was very important, or for personal business, whether you're working or involved, or you need to be talking to your accountant, or for other business areas, to be able to field questions. And then it depends, we'll return later talking about the role of captions, caption phones, live transcript, which you're familiar with because you have the benefit of belonging with HLAA that keeps you informed of some of the newer technology and options. And this has also advanced, fortunately, during a silver lining from the pandemic. So Auditory training, what does it consist of? The goal is to improve listening skills and overall communication. Either an audiologist or a speech language pathologist can help you with the training program, and it's presented in a hierarchy depending on where you are, whether it's detecting the sound, discriminating between two vowels, understanding, and also the role of auditory memory. Something that's called, just to give you the terms, bottom-up or analytic training, that's nothing more complex than discriminating between different vowels and consonants alone or in combination, so that you know what they're saying, but it's hard to differentiate, especially with consonants. The top-down synthetic training is where in our research we've put the majority of time with that, although there's some time with a bottom up. It depends on what the needs are, where you're listening in context. And it's training to enhance your skills, where we present words, sentences, material, and context. What about the content? Are they sentences? Is it spoken language or more formal technical language? And the training can be done with or without speech reading, different rates of speech. On some of the apps that you have for listening to books, there's ways to adapt the rate of speech. I grew up in New York, and New Yorkers speak about twice as fast, so I've been very careful to slow my own speech down. Recorded or live speech, quiet or practice in noise. And in terms of speech reading, lip reading training, speech reading is the overall. Lip reading relates to the focus on the lips per se, but the whole goal is to improve your communication, to get more information visually. And again, there's also analytic, looking at sounds by the mouth shape, learning which words have the same mouth movement, but a different meaning can be very useful to increase what you're understanding in conversations. So you go, oh, I'm looking, this is an M and a P. I will speak briefly about that, but also, so we'll enter it after. Synthetic training to understand meaningful speech through speech reading. So, for example, the sounds of speech, as you probably know, are divided into vowels and consonants. Vowels are easier to hear, but harder to see, especially if someone has an accent. Homophones are words with sounds that look alike, like p, b, m. So the following words are all homophones: pie, buy, my. But because you understand context, you would know that it would be, I like apple pie, not apple buy. I need my book. I go by the library on my way home, and I can't read the last because I have the captions covering the last part. That's fine. Clear speech. This is something that can help your significant others, your loved ones, learn to speak more clearly. There are 4 things that they can do when they speak with you. I don't know if any of you have tried this, having them slow down a bit. And this doesn't slow down a bit is one aspect, speaking a little louder, saying things clearly without exaggerating. And a key thing is pausing at meaningful places so that your ears catch up with what they're saying. So instead of saying, my husband's sister is coming to visit us in Florida in April, my husband's sister, they take a break, is coming to visit us, pause, in April. And so the combination of a bit slower, and once you've gone over this with your significant other, you can develop 1 or 2 nonverbal ways which let the conversation flow without as much disruption. So much like slow down with a hand signal, talk a little louder, the hand going up, just whatever works between you. And remember that the people who love you, they're busy trying to communicate what they want to tell you. They may forget what works for you. And this can happen. This happens with family all the time. and I observed it in my own family. People need reminders, they need praise, and you need a little humor. It's to roll with the misunderstandings. My husband has a mild hearing loss. I have a mild high frequency hearing loss in 1 year, and when I miss something on the TV, one aspect that Diane will come back to later is about confirmation to help to help the flow of communication between you. Did they say that John's going to the beach? Or and finding some way with humor, slow, hey, honey, can you say that again? And pause. Your husband's going, okay, where's he going? All these things can help the flow, reduce some of the stress, and make things a bit easier for you to catch what's going on. Diane, Professor Brewer will discuss this more in depth, but communication strategies training can help strategies to the anticipatory strategies. The whole idea behind the strategies training is to have you feel empowered and to understand that as you enter a situation, it's problem solving. Okay, I'm going to a show. What can I do? Or who am I going to meet? So that you begin to think about the situations and what you might have some degree of control over. Not always, but there are things that you can do that can make strategies that can make communication more effective and a bit easier. Environmental strategies let you evaluate and modify the environment to make it more successful. Maintenance and repair, how to keep the communication going and repair communication breakdowns when they occur. So I want to talk about Professor Brewer and I in our recent studies, we put together a program that's multi-component. So that involved, want to give you experience of two of our clients. What it involved is we provided auditory training, informational counseling, so how to get the most out of their implant, work about information and about assistive technology to their needs, communication strategies training. And for example, this particular person was a 56-year-old male who was using cochlear implant, lost his hearing due to noise induced hearing loss. He had his implant for about 4 months, and the duration of profound hearing loss, he had a progressive hearing loss, was about 2 years. When he started, when you see on the left the outcome measures, CAS%, CAS% are topic-related sentences. This was material developed by Arthur Boothroyd, recorded, and when this client began, in quiet, the score was about 78%. An audiologist might say, well, you get 80%, that's pretty good, but it wasn't sufficient for what he needed and wanted in his life. The HLAA that you're looking at, that's a hearing handicap inventory. And what that measures, this is where we get information from clients to know what's the impact on your life socially, your social, the activities you're involved in, and emotionally. And the higher, it's on a range from 0 to 100. A score of 17 means you're doing well. The higher the score, the more impact it's having on your daily life. And this person, the total score to begin with was a severe impact, both socially and emotionally. In terms of the top 2 goals in his life, the first goal was by listening only. He needed to hear at work that when 3 people would meet in the essentially the next carol right next to him, he wanted to hear the gossip in the at work, because then he knew what would be going on. That was his top goal, so that he could function best professionally. The second one was being able to be on the phone at work with unfamiliar speakers, people who he needed to function with. And when he started at that level, he was at understanding 10%, for hearing his colleagues by listening alone, 50%. After the training, on the right-hand column, you see His speech understanding and quiet went up to 95%. We're talking about once a week for 6 weeks, that even a small amount of training can make this much difference. Most importantly for him, his total hearing handicap, the impact it had on him socially and emotionally, reduced way down, enormous improvement in function. And on his personal goals, while it wasn't 100% for his ability to understand his colleagues in the next carol, it went up to 75% of the time he can understand there. And on the phone, he was able to do better, but that was primarily due to exploring his comfort level and use of caption phone at work.
Are the result of having different degrees of
simpler
loss of different
solution.
pitches, making those harmonics out of whack, not balanced the way
Was there a question? Oh, okay. Oh,
I'm sorry, somebody just entered
okay.
without muting, so I just muted them.
You've
You've gone ahead.
It's okay. By the way, when Professor Brewer and I and Antoine have presented before, this is good, but we love being in person because then there's even more exchange spontaneously. Let me present about another wonderful client of ours to give you real life examples of what the rehab meant in their life. This was a 67-year-old woman using cochlear implant, familial history of genetic hearing loss. She had her implant, this is about 3 months after activation, but a duration of profound hearing loss of 17 years. So many times, audiologists and ENT physicians will refer clients to us when they consider, oh, they're struggling. By that, they'll be looking at what you see CAS% score, or basically a speech test score of around 20-30%, lets them see that, okay, we gave someone a cochlear implant, but they're still struggling. Can you help our patient? Okay. She came in, and the impact in her life, a score of 58, close to 60, is she's having significant impact on her life socially and emotionally. That's limiting what she needs and wants to do in her everyday life. One of her goals was to hear 1 or 2 friends in noise. The noise was at dog shows, which she would attend. And when she started, her understanding in that situation was about 25%. Another goal was to be able to listen to her soft-spoken husband, who was ill with MS in bed, and she was the primary caretaker. At the end of the 6-week training program, her score, forgive me, for speech understanding, but this is only in quiet, was 52%, and a significant improvement. I can tell you that on data-based, an improvement of 10% is considered clinically significant. And a reduction, not all the way back to normal in terms of hearing handicap, but way less, from 58 down to 36, of the impact on her everyday social life and emotionally. Also, she was feeling, after the end of training, another aspect is feeling more confident in her ability to function. So for understanding 1 or 2 friends in noise, her score went from 25 to understanding 75% in that situation. And very personally, with her husband at the end, being able to understand 50%, which was dramatic. What she said is it was a combination of things, that by using, showing her how to use which program and get the most out of that, using communication strategies, turning down the TV before they had a vital communication of what medicine he needs, and also using a combination of a listening device. The combination of all 3, she said at the end, made a dramatic change, that she was less stressed and her husband was less pissed off. It altered the quality of their life. And that's really why we do what we do, because we can see huge impact in the daily life of the people that we work with. We presented this in different places. When we presented this to the team at Hopkins at one point, Franklin, who you've heard of, Dr. Franklin, said, this is wonderful. What do you do? But can you do it in 4 weeks? Can you turn it into an app? And yes, there are apps that are out there. Yes, there's online training that you can absolutely use, that can absolutely benefit. But our experience is that there's the role of a clinician to work with you, to get you to a different level. You can work on your own, but the guidance, the professionalism, the knowledge, the feedback of how you're doing, how to guide you. You may need some parts of of AR, you may need all of it, and that can make a big difference in people's lives. I'd like to we're very grateful for grant support from the National Institute on Disability, Independent Living and Rehabilitation Research, NIDLR, which is a center under the Department of Health and Human Services. Thank you. Thank you very much for inviting us. I'd like to turn it over now. I'll stop sharing to Professor Diane Brewer.
Okay. Now I will get my screen share up. Okay, let's see. Why is this not sharing here? Share. Just a minute. I'm going to try that again. Because I'm not just on this, so I'm going to start this over again here. Let me put that back down. And I still have Claire here on my picture. And let me get this opened again. I'm having trouble opening this. Do you think you have to go off, Claire, before I can do this?
Yes, maybe I do. Lisa, do you need to take me off of co-host?
No, you need to close. I don't know. But this is not opening. Let me.
So I will try taking you off co-host, Claire, and see if that makes a difference.
Okay, let me. Right now, I don't have that screen up, so let me get rid of that. Let me remove that and let me open this. This must be open somewhere because it's not behaving. Okay. So.
Do you want me to try? I have your PowerPoint.
No, let me do it now. I think I will. Do you see it now?
We did see it before momentarily, but we don't.
And then it just
now we have
disappeared.
it. We have it.
You have it now. Okay. So now let me get this to where I can have just one picture there. Okay. Now we're okay.
We're good. We're good. Thank you.
Okay. I'm going to say this one now. I have either a cold or allergies. I don't know what, but if I'm doing this, it's not to be rude. It's, you know, you'll all be jealous. It's hot lemon water, which is supposed to let you keep talking without being hoarse. Not the best. Okay. So Clara introduced this, and so you already know this slide, and so we can kind of move through that fast. Communication strategies. Why do you want to have those? And the answer to that is because sometimes the hearing aids and cochlear implants, although wonderful, still leave you not understanding. And so there are places where it's difficult. So this is about what can you do to mediate that. So these are 4 areas that we talk about that are ways you might control the situation. Thinking ahead, you might say, I can anticipate what's going to happen. So for example, if you were going to go to a doctor's office, well, there'll be a slide about that in a minute. You think about, what are they going to say to me? What am I going to say back? And so you've thought of things, so you're not just getting something out of the blue and trying to piece out the words as opposed to the situation as well. A second area is the environment. What can you do to change your distance from the speaker, like sit in the front row, or use an assistive listening device? What could you do to control the noise in the room? What could you do to control the lighting in the room so you could benefit from speech reading? The next thing is, where could you put yourself that would give you the ability to A, hear better, and B, to do lip reading. So that means you're going to have to go toward the front of the room to do that. And then the fourth thing is, help the talker know that you need help so that they learn that you want to hear them, you want to know what they said, but you need a little help from them to do that. So in terms of anticipating, you use your expectations of the situation. So think of the names of people that you're going to meet, of places, of topics that could improve your understanding. When you're familiar with the topic, it's easier to fill in, it's easier to understand what people are saying. You can also use speech reading. So these are part of your toolkit, as you could say, to be better prepared to get through the conversation. So let's start with the first kind, anticipatory strategies. So if you were going to go to the doctor's office, you think about, what will the receptionist say to you? And truly, there are a limited number of things they usually say. So just kind of think of that ahead. And I think for some of us, just as humans, myself included, when I get into a situation where I don't know what I'm doing at all, I can't process very fast. I don't listen as carefully because I'm hearing words, I don't quite get the meaning. So maybe rehearse it in your head a little bit. What are they going to say? And so let's look at what would be some things. Can anybody volunteer? If I walk up to that desk, what are they going to say to me?
I'll volunteer one.
Okay.
Since getting older, there's been a shoulder injury, a back injury. And when I go to the orthopedist office, this is a new one for me, and they're all masked. This has happened 3 times. Say, what body part are you here for? I am not making this up.
Oh, I haven't had that experience. Well, I might not know to rehearse that at home, right? But anyway, think it out beforehand. And so you could know they're going to ask your name. They're going to ask you to fill out a form. They're going to tell you where to sit. They're going to tell you how early or late the doctor will be. Go through those things ahead, because it's stressful when you're at a place where you don't really know what's going to happen. So another idea is, if you went to a meeting, okay, what might you do to help you at a meeting? And this is one of the things that came up often, and people, of their choices, their 3 choices of things that they cared most about it. Meetings came up a lot, either at work or social, or on many committees people are on. So an example is, who will be there? Who will be at the meeting? So if you know the names of the people that are there, that will help you get through the situation if you're introduced to people. If you're going to be in a panel and you know who the other talkers are, which you obviously probably would, that would make it an easier thing. So thinking through things like who will be there, and how could you help yourself? And we'll do more of this in a minute. The next thing you could do is you could change the listening environment. Can you improve your ability to understand by manipulating the environment you're in? And so here are examples of what you can do. You could move closer to the talker. Distance is your enemy when you're trying to hear. And so the closer you get to somebody, the better you can hear. And also the closer you get to them, the less the noise is going to affect you. You could sit in a quieter part of the room. And probably most of you do this and know this already. You can sit where you can see the face of the talker, or you could use an assistive listening device. And all of those are good remedies for that. And one of the things that we talk about in therapy is helping people be willing to do it. In other words, if you need to hear something at a meeting and you need to sit in the front row and all the seats are taken, many of us are reluctant to go up to somebody and say, is there any way you could sit back here because I have trouble hearing and I need to be in the front to read lips or to hear. But that's what you need to do. And so one of the things is to work on getting comfortable with taking care of that. Because if you're me, you're never going to get there early enough to get the front row, probably. So you have to be willing to do that kind of thing. And assistive listening devices, we won't talk much more about today, but you probably have talked to those, or you can, with your audiologist or your implant audiologist. And I'm going to keep going because of time. So let's take a restaurant. What could you do there? So you have to think of things like, what's your best place to sit in this restaurant? So look at this map here of a restaurant, and let's go around it for a second, and then you tell me, somebody, where you want to sit. So in the restaurant here, we have this piece here. Okay, let's go. Here's the front door here. So it's sort of a rectangle with a little cubby here. So this is front door, big window here, big window here, big window here, and these are wall lamps. Okay, this is the kitchen door. The dishwasher's right there. There's another wall lamp here. There's a piano here because this is a classy restaurant with a piano player. So look at these for a while. It may take a few minutes to think about it, but which table would you pick? Can anybody decide? Or since there's so many people, maybe this won't work. What do you think about, would you sit at table 10? Just shake your head, whatever. No, why not? Because there's a dishwasher there and it's a kitchen door. And would you sit at table 11? No, because the same thing, it's too close to the kitchen. It does have a wall lamp, so you might lip read, but probably not. Okay, how about table 9? You're gonna sit there? No, the piano. Yeah, not good, not good. 8, not good for the piano. Okay, over here, 1, 2, 2, 4, and 3, 5. So let's go through these. Would you sit at 4 or 5? And it's no. Again, you're right by this piano. Again, you can see a little bit to lip read, but you're going to not hear anybody. And these, sort of the same thing. They're still kind of close to the piano. They're better. This one's probably better than this one because the light might be better there. And this one might be better, except what? You've got the front door there. So that's going to be another noisy place. So let's go to these tables here, 6 and 7. You could pick between those in part, and I'll just do it because it's too hard for everybody to answer and talk. You've got a window here, so you're going to get a lot of lighting if you want to be able to do speech reading, lip reading. So that part of it's really good, still a little close to the door. This one here, again, you've got 2 windows around it, so you're good for lip reading. But then you'd have to think of which seat you would take at that one if you took it. For example, A and B are going to be the path that all the new people walk through probably when they come in. The person who greets them will take them that way. And also, more importantly, if you're dependent on lip reading a great deal, A and B have these windows here. And if it's a daytime event, the light from the windows will blind you to the lips of the people on this side of the table. So that wouldn't be good, but the table from this side would be good because there's nothing back there. And you've got the good light on these faces. And so you could do well there. So that's a longer example than I gave in the other 2 of what you could do. And now you're saying, well, how am I going to get a floor plan of the restaurant? Well, one thing, if you are really struggling with restaurants, you kind of need to know what they're like before you go, if it's an important time to be talking to people. And so you also can look up in the Washington Post and magazines the decibel level of the restaurants. and they're graded by quiet or not. Finally, for years, they wouldn't do that. So you can decide that you can't do it. Like Claire and I and our husbands went out to dinner not so long ago. And surely I would never go there if I was having a significant hearing problem. It was so loud, but it was fun. Anyway, so those are things you just have to decide and decide ahead. When you make a reservation, if that's what you're going to do, you can say what table you want and they will accommodate you. So a thing people sometimes don't do is have the nerve to do that, but that's just what you do. And, you know, say, I have a hearing loss, I need to sit here, just like you can at the theater say, I have a hearing loss, I need to sit somewhere around here. But it's easier when you get tickets to something because you see the seating. Okay, so we better hurry on from this. Let me get, why is this not moving here? There we go. So here's another practice thing, if anybody would answer this. So this is at home. You're sitting talking. What changes could you make to that situation to make it easier to hear? Anybody got an idea? Claire, you got an idea?
Okay,
Yeah, go ahead. Yes.
you need to see, I can't see the picture.
Okay, I can't, wait a
You
minute.
can't? Oh,
Oh, here?
Yeah.
It's hard to see. Oops.
can you see it, Claire?
Yes, I think there are some people who can see it and want to respond. Was that Russell, or is it?
I don't know why it's not. I don't think there's anything here I can do to make it. Is it on yours, Claire? Can you see it?
I can see it, but you may need to
Yeah.
move on, or maybe Lisa, do
just-
you have a comment on this perhaps?
I
So,
can see the-
so
Oh.
why are you having trouble seeing it? I don't know what you're using, a computer, or you might be able to look at the view up in the right-hand corner of the Zoom screen, which will allow you to shift what is your main view and what is the and what is you know the gallery or whatever you're watching for the people view. So
Well,
see if
I
you can do that. But I know different, you know, if you have a tablet, I'm not as familiar with that.
Yeah. I can describe the picture. So it is a living room of a home, and there are windows behind the people, and there's I don't know if it's sectional or not, but a sofa that goes in a half circle. So the people are not going straight from each other. It's a little half circle. And there is a presumably father and one child here in the middle, puppy dog, child, and the mom and the family. And so one of the things you'd think about is maybe you would do better if you were the mom who had the hearing loss and trouble hearing. She wouldn't sit there. She'd move over and sit here so she could do lip reading, because it's hard because the people, it's like any couch you sit on, sofa you sit on. You have to really crane your neck and follow where people are, and you can't really see them because they're talking the other direction. So just your placement in the room. You demand a certain chair, have a certain chair. So that would be a pretty good setup if your chair was over here. So thinking out things like that, we can just skip on with that one.
Diane, this is
yeah.
Lisa. Some of the people put suggestions in the chat too. So
Oh,
I don't know
okay.
if you can look at it, but if you want one of your co-hosts or for me to read them, we could do that too.
Okay.
I could add some of them. So Diane, you don't need to look at that. You can be able to talk. Some wonderful things talking about, Les said, Peter asked if they have zones in their sound system, if they can turn it down in the area. But before that, Peter said to everyone, I asked to eliminate background music. They almost never comply. I agree. It's very tough. Let's say someone has the TV on. They may not get rid of it. Sometimes they can turn it down, or you may have to actually go to a separate room. You have to know or let's say there's an air conditioning on, you may not be able to turn it off, but turn it down. Getting to some place that's quiet. Yeah, you're just going to have to move further away. Some people will help, or they need to be reminded, or they'll still turn things on. There's a comment also from Russ. Additional, stay away from large parties, more than 4 people. They have a hard time hearing each other, and so they talk loudly. Some people talk loudly anyway, Russ. It's true. And if you have a large family or children, they're moving targets. It's hard to control, but you could separate. You can consider smaller groups, but when it's not possible, you may have to move out of the room to where it's quieter. Thanks for everyone's comments.
Yes. Sorry, I'm looking at that. Okay, let me get the next slide now. And this, I think, because we're a little bit late today, I'll just go through and say, think of a situation that's difficult for you, and what could you do to prepare for it in advance? What could you do anticipating what the problem's going to be? And that's what you want to do when you're going to a situation you don't have any control over. To some extent, the restaurants you do have some control over. You don't have to go to it. You could pick another one and you can suss that out. And there are also some articles that have been in the Post in particular about restaurants that are suitable for people who have trouble hearing. And so you can check out some of those things. And you can also call ahead and ask questions about it. That may not be as easy as I think it would be. So I'm not going to stop to do this now because I'm afraid we're getting into somebody else's time. But these are the things you're trying to think about. Okay, let me get the next one. So here's another one, name an anticipatory and one environmental strategy you could use here. So if you were out at dinner with a group, can anybody name something they could do to make it easier, something of anticipating that would make it easier for you, and something you could do to control the environment. So does anybody have any? Let's pick who's the person with hearing loss. Let's pick the end of the table. Let's say these are the grandparents and these are the parents and these are the grandkids. And let's say that this is the person who's having trouble hearing. What could they do at that table? Anybody got an idea? Yeah.
I have this situation. I have 2 13-year-old granddaughters, twin granddaughters. And what I try to do at family gatherings, and they're wonderful about, is think about positioning myself.
Mm-hmm.
And I usually make sure I position myself so I'm looking directly at my granddaughters. So I can use lip reading, or I'm sitting right beside them so they're close to my devices. Mm-hmm. And I found that has helped. Also, thinking about the lighting in the room, which makes a difference in lip reading. And I think being brazen enough to ask that the television or music be subdued or turned off, that kind of thing.
Yeah.
Always pretty supportive of that.
Great strategies. Yeah. And grandkids are hard too, because their voices are either really loud or not loud, right? At all. And so in the spectrum of their speech is different. So that's a difficult thing. So one of the things is figure out, and this is in terms of seeing the adults here, that's pretty good. And presumably if those are their children, they can tell them to talk louder in a very comfortable way, but you might be in that situation with somebody else's children. So at a lecture, so let's say one anticipatory, one environmental. So what could you do in anticipation of going to this lecture? If anybody would come up with the answer to that, an answer to that. What would you do thinking about going to the meeting and knowing you might have trouble? What would you do? Any takers?
I can offer something. I would get there early so I could sit in the front row.
Yep. So get there to get the front row. And even if you don't get there to get the front row, say, it's okay for me to walk up to somebody and say, is there any chance you could trade seats with me because I have trouble hearing? Just like you would if you had trouble seeing. And I know that's a harder thing for people to do sometimes.
Another thing you could do, which I've occasionally done, is, I mean, if we're using a personal device, a small microphone and so forth, you can just ask the speaker to use it.
Yes, yes, absolutely. And that's if you have assistive listening devices, which many of you probably do, you talk to the speaker again. That makes you get there early so you can catch them first. But and some people are very shy to do that or feel like it calls attention to them, but I don't think it does at all. And I don't know of really any circumstance where somebody isn't happy to wear whatever you give them to wear. So so that's another thing that would be really good. And if you do go to a lot of meetings and that's important in your life, then looking into assistive devices is a good thing to do.
One of the other things, Diane, that I've worked with clients is getting the agenda of the meeting ahead of time.
Excellent.
They have a better sense of what the person is discussing, where they are, so you would have a sense of what vocabulary you might be.
Absolutely, absolutely.
Diane, there's a comment from Les Greenberg, and then we'll shift over to Miss Allen.
Okay.
I think we need to all, on meetings like this, if we know in advance, ask if they're going to have captioning, ask if the room is otherwise set up for us. If we all speak up, we can get things done. We need to work together and advocate.
Yeah, I think that's a really good point. And I think that people don't know unless you ask them. I mean, it isn't that they don't want to do that. Maybe somebody doesn't, but they don't know to do it if you don't tell them that that would be what would be the thing to do. So that's a great point. Okay, so now we're going to talk about repair strategies. And so now you have
Professor Brewer.
Oh, that's a comment.
Because you don't have a clock, we want to make sure, Antoinette also, we have so much material, we could even stay after, but now before the meeting runs out, Antoinette, Allen to have, and then we can maybe come back.
Okay, you want me to stop here? Is that what you're saying? Okay.
Unfortunately.
Okay, that's fine. That's fine.
All right, all right. I am going to attempt to share. This is not one of my best skills. Let me go here. This. Share. Seeing that, everyone?
Yes, we're seeing it.
Okay. I'm going to pull everyone down so I can see. Thank you all for having me. I am going to try to just jump off of a lot of what Claire and Diane have been talking about. I'm going to shift off of one of Arthur Boothroyd's definitions. I'm going to add on the area of integrated oral rehabilitation, an integrated model of oral rehabilitation or hearing therapy or communication therapy. And that's kind of where we come from when we in our practice are working with individuals. So we're working with that multi-component AR that Boothroyd talked about. And we perceive it as the retraining, the rehabilitation, the support of communication areas that have been impacted by the hearing loss. And those areas are included here. I'm only going to address a few of them that I think might be more appropriate for this particular population, being that population that has been listening and speaking for the majority of your life, and it has a hearing loss now and is losing one of those components. So one of the areas that is impacted, obviously, by hearing loss are your auditory skills. You no longer have access to all of the frequencies, the levels of dB, the intensity, how loud you want something to be versus how loud it is. And to some degree, that has impacted your ability to be able to interact in your environment on a daily basis. Another area that is impacted is technology, because now you have hearing aids, you have closed captions, you have caption phones, you have implant, you have a variety of different things now that are technology-based that are associated with your overall ability to communicate. You have speech reading skills as an area that Diane and Claire have talked about, that now you need to be aware of. How much information am I taking into my communication visually? Am I taking into account people's mouths and what they're saying, what I see here, their body movements, their facial expressions? How much communication am I able to get from that? And I really want to focus on the fact that people absolutely need to be focused towards that at this point in time. Strategies, they've talked a great deal about strategies, which are huge. What can I use? When can I use it? What is more beneficial for me to use in a particular situation? And we'll talk a little bit more about that. Informational counseling and adjustment. The information you need now about listening, which is something that we all just did naturally for so very long. Now I need to know, what can I hear? When can I hear it? I can't hear over here. I need to watch in this situation. I need to sit in the front of the room for this particular lecture. How am I going to adjust to all of those things? Another area is speech and voice skills. I think a lot of people are not necessarily aware, if you have a particular type and degree of hearing loss for an extended period of time, your ability to be able to hear and understand people out and about around you is impacted. But over a period of time, your ability to hear your own speech and your own voice can also be impacted. So it ends up being that you are speaking much louder than you absolutely need to because you can't hear yourself. It comes to the fact that with some types of sensory neural hearing loss, you may be even speaking softer because of the impact on your ability to be able to hear that. So these are areas that we actually work on directly because they have been impacted by your hearing loss. Language and pronunciation skills, I'm going to leave because those are more specific to a different population. But if we have time for questions, we can definitely talk about those a little bit later. So the integrated model is specifically tailored to that individual based on their background. We take a huge amount of background information. Most of my clients are like, whoa, so many trees are being killed by me sending you this information. But indeed, it helps us to be able to integrate not only just your hearing loss, but who you are and what you do. I have a specific form that is about let me get to know you. So I want to know about your name and your kids' names and your wife's name and where you work and work terms and coworkers' names, because these are the things that we're also going to incorporate into your therapy, because these are the things that you're going to be listening for on a day-to-day basis. I want to know about your wants and needs. As Claire and Diane talked about, what are your listening objectives? Do you want to be able to communicate at work, communicate one-on-one, be able to listen to your 5 granddaughters whose frequency levels of their voices are way above what your hearing level is? What kinds of things do you want to work on? And that's kind of where we try to narrow ourselves. We also do testing, and we base what we work on our testing results. So I'm talking about functional testing. Your audiologist tests your hearing objectively. They're looking at what your objective hearing levels are in the booth, in that perfect setting. What are you able to do? And we absolutely need that information to do AR. But what we're testing is your functional use of your hearing. What are you able to do outside of that booth, given different kinds of situations? Integrated therapy, AR therapy, is appropriate for individuals with documented hearing loss. Any individuals with documented hearing loss that the testing results indicate that they would be able to benefit. People with and without hearing aids, people with and without implants, people using other devices, and people from deaf culture as well as hearing culture are individuals that we see as part of our services. So now I'm just going to talk a little bit about each one of those particular areas that are addressed in the integrated therapy model. Obviously, audition is one, and our functional auditory assessment does an assessment of the analytic skills as well as the synthetic skills. And Claire talked about the analytic skills being bottom up. So basically what we're assessing is your ability to be aware of and discriminate and identify small distinct differences in vowels, E versus it, or heat versus hit, H-E-A-T versus H-I-T. Also your ability to make those distinctions in then words and maybe phrases and then sentences. So now we're looking at the ability to assess your skills in synthetic areas like words, phrases, sentences, etc. We do that with and without visual. So we have you listen and also be able to see the person. And then we take that visual away because we want to know how you're functioning with auditory only. We do it with and without background noise because we want to be sure that we're trying to represent the areas that you're experiencing on an everyday basis. And a lot of people obviously have difficulty in background noise. Those results will lead us to what areas we're going to work on in the training. What areas analytically can we work on to make you more aware of those specific and small differences in those sounds? What areas synthetically can we work on as far as words and sentences and passages to be able to support your auditory skills and have you be able to function a little bit better? One thing I want to address here, and I don't want to take too much time, is Erber's levels of listening or his hierarchy of listening. And I think it's important because people need to know that listening is simply not looking around and being able to hear. I work within this framework, and most of the people who work with me work within the framework of Erber's listening level. So I'm going to say those folks who are part of PG group have probably heard this example before, so please bear with me. There's a sound over here. It might be your microwave buzzing. And there's a sound over here, and it might be your phone ringing. And there's a sound over here because there's a person saying, how are you? There's a sound over here because there's a person saying, what time is it? So me as the person with hearing loss, I hear that buzzer and I'm like, oh, that's a sound. And I hear that phone and I say, oh, that's a sound. And I hear that person say, how are you? And I know, oh, that's a sound. And I hear this person say, oh, what time is it? And I'm like, that's a sound. So I am aware of all those sounds, but I'm not acting on them. I am simply aware. The next level is discrimination. So I hear this buzzer and I'm like, oh, that's a sound. And I hear my phone and I say, that's a sound, but it's different. Those two sounds are different. And so I'm able to discriminate them. I hear this person say, how are you? That's a sound. I hear this person say, what time is it? I'm like, that's a sound, but that sound is different from that sound. So those are the ability. I'm a person now who's functioning with the ability to discriminate. I hear that sound, I can identify it. That's a microwave. I hear a sound, it's a telephone. I can identify it. It's a phone. I hear this person speak. They say, how are you? That person said, how are you? I hear this person speak. I can identify that that person said, what time is it? So my next level up is my ability to be aware, discriminate, identify, and now can I comprehend that sound? The microwave buzzes and, oh, my food is finished, so I'm going to go get it. The telephone rings, I need to go answer the phone. The person says, how are you? I say, I'm fine, how are you? The person says, what time is it? And I'm like, oh, it's 2 o'clock. So we work within all of those levels, dependent on where that person falls in their results in their auditory testing. And I'm going to say that I even use those same levels of awareness, discrimination, identification when I'm working on lip reading and speech reading, because you need to be aware, then discriminate, and then be able to identify. So when working on lip reading and speech reading, as Claire and Diane talked about and said, that is an area that is definitely recommended because it leads to more successful communication. Assessment of speech reading consists of assessing those analytic skills, as Claire talked about, the ability to look at that person's mouth and determine, did they make a sound in the group from ba, pa, ma, or did they make a sound from the group with and so we work on identifying what your abilities are there. And then we move on to assessing your synthetic skills. Can you identify that I said, good morning, or where are you going? We do assessment at word, phrase, and sentence level, with and without auditory input, with and without visual noise, and visual noise being that there are other things going on in your visual field that may distract you from that speech reading or that lip reading. And we do the assessment with and without topic or context. So we try to look at those results, and those results lead us into what areas specifically we want to address with the visual areas that will support good, successful communication. We teach Viseme training. Visemes are kind of like visual sounds. So you're looking to see how well you're aware of them, how well you're able to discriminate them, how well you're able to identify them. And then we apply that Viseme training to the synthetic training. So we're looking now to see how well we are going to work on putting those into words, and you're being able to identify the word or being aware of the word or discriminate within a phrase. So we move from our results then into the training. I know I'm going really fast because I don't want to miss anything. Communication strategies, I don't think I need to say much more. I think it was covered very, very well. One thing I will add is that one of the areas, as Diane talked about, is that people are very reticent to go up to someone and say, I really, almost like I need your seat because I have a hearing loss. But we also talk about the idea of communication behaviors. So we talk about how to be assertive without being aggressive, and absolutely do not want you to be passive, because that doesn't lead you towards being successful in your ability to communicate. So being assertive would be telling the person what you need. I need you to look at me. It would tell them why you need them to look at you, because I have a hearing loss, and how to adjust themselves. Please speak clearly and open your mouth a little bit wider. So we teach those things in an easy environment, in an environment in a big lecture hall where it might not be as easy for you to do that. And so we do that as part of communication strategies. But similarly, we assess your ability to use receptive strategies, and then we move from those results into how to sort of beef up your repertoire of strategies and when to use them, what to use in certain situations, what not to use in certain situations, what you're comfortable with, that type of thing. The expressive communication strategy area there mostly addresses that area I talked about with speech, where if your speech has become a little bit distorted and others cannot understand you, what kind of strategies do you use to help others understand you also? But that's a separate kind of area. And there's speech and voice. So talking about that area of speech and voice for those people where their speech and their voice may be impacted by their hearing loss. We're looking to see how well your speech is intelligible or understood by others. So we evaluate your articulation or your speech sounds, and we evaluate them in isolation. We look at them in words, we look at them in phrases, when you're reading, and in general conversation. And we compare and contrast where the breakdown occurs. And those results lead us into what areas we would work on in the speech training. We will evaluate your voice, and we're looking at loudness. Are you too loud? Are you too soft? Is your pitch too high? Is your pitch too low? Nasality. Often what happens is when people have hearing loss, they may start to be more nasal because they can't hear they can't hear themselves as well, but they can feel the voice more through nasal cavities. So their voice almost starts to become more hypernasal, so to speak. The other thing we might find is that your voice might become hard or harsh because, again, you can feel it more than you can probably hear it at this point in time. So we would work on whatever areas may be impacting other people's ability to understand what you're saying.
Thank you, Antoinette. This is Lisa Hamlin. We're getting real close to the end of our meeting time.
Okay, then I'm good. Informational counseling, you guys have already talked about, and I'm just going to let you guys go. I'm going to stop share. Okay.
This is Lisa again. Lisa Johnston, do you have a couple of extra minutes so we can ask a few questions, or do you need to run, in which case I'll just turn on the automatic captions for a while?
I can stay, Lisa.
Thank you so much. So we have a few minutes, but I don't want to abuse our privilege here. And so a few questions, and then we'll call it a day here. Go ahead, please. Claire, why don't you take it away and see if we have questions? Anybody want to raise their hand or just jump in?
Anyone have a question in the audience? I'm looking to see if there's any hands raised. Antoinette, did you see someone?
I saw someone with their thumb up, Peter Unger. Maybe?
Oh, Peter Unger, yes. Peter, please ask
Well,
your question.
actually, I'm just endorsing the 1.5 hour program. It was great, and thank you very much. Those are good, a lot of good tips. I've been a veteran cochlear implant user for, I guess, 10 years now. And I keep learning something new, and so I appreciate that this program. Thank you.
Oh, thank you for that. There's more. There's a hand raised. Joe Marshall.
Hi, can you hear me all right?
Yes.
Okay, I've been wearing hearing aids for a number of years, but they're starting to affect my ability to participate in musical things. I'm singing a chorus, and I'm looking for can you direct me somewhere where I can get tips on preserving and improving my ability to hear pitches and participate in music? Thank you.
That's not a direct area, but I've read about musician in-ear monitors, and I can try to get, you can have, we'll send our email to Lisa Wan, and I don't know if I pronounced that right, and we'll try to send you some information to help you with that.
Okay, thank you very much.
Of course. Paul Silverman.
Yes, hi, thanks, and thank you for a very informative presentation. I'm curious about logistics. How is this done? How are the charges arranged? Where is it done? How much time is generally involved in going forward with your program?
Wow. Okay. As they say with the TV news announcers, well, that's a lot to unpack. Starting with where and how is it done? We are Antoinette Allen. Unfortunately for us, has left Gallaudet, but she has a private practice. So where it's done in this area is her relatively new practice. Gallaudet University has a speech and hearing center providing rehab services. Right now, they have a waiting list probably till the fall. Diane and myself run.
And also GW has a clinic that is a possibility. So for this kind of service. So, okay.
Right, Diane was saying GW, George Washington University also has a clinic providing that. University of Maryland at College Park also. And we have provided services, Diane and myself, as part of clinical research. We've done in person as well as remotely over telerehab. In terms of part of a study that's free service, part of for any of the university-based, when you reach the clinical center, they will tell you, they'll check out your insurance and see what's covered. Did I get all the questions? Was there more to?
That's quite thorough. Thank you.
Of course. Let's see. Joe Marshall still has a hand up. Is there another hand up? Usually when we've done this presentation, this is more rigid. We start asking, so I'd like to do one thing at the end where someone volunteers a situation that's difficult for them. Part of what we like to engage you with is experientially. You present a situation that's difficult for you, and then together, it's not just a professional learning the strategies and the options. We talk together with what can you possibly do to improve how you're doing in that situation. Is there someone who wants to start with a situation that's tough for them and challenge the group to come up with possible solutions.
Claire, just before you do that, this is Lisa again. Russ had his hand raised,
Oh,
so
my
you want to take
apologies.
his question
Yes,
first and
I see
then.
Sarah and Russ. Russ, go ahead, sorry.
Thank you, thank you. Actually, I had two questions. You know, first one, I guess, is for Claire. Claire, it's good seeing you.
Nice to see you.
You know, you've mentioned, I think, some of the things that can be done to reduce stress on communication in difficult environments. And I'm just wondering, how you can improve, communications. But what I'm wondering is there any research been done on, the extent to which not only communications improve, but the extent to which it reduces anxiety? Because I think, one of the problems a lot of us have is we avoid situations entirely because we anticipate exactly how difficult it's going to be. And then we have to, so I'm wondering whether there's any research been done on reduction of anxiety, in connection with auditory rehabilitation. And okay, the second question, and this is, I guess, basically for Antoinette, in terms of integrated training. And a lot of what you're talking about, I think, is really making yourself understood, situated, ways in which you can make yourself better understood. And that strikes me as great, but what I'm wondering is, a lot of it is, it seems to me ought to be done, for hearing people. I'm thinking, my daughter's lovely. She's a wonderful person. She also talks too fast, and her communication strategies are ingrained like most people's. Yes, you can ask her to slow down a little bit, for a while, and 30 seconds later, you have to ask her again. And all that's fine. But I'm just wondering, whether the extent to which you're involved in training people, in strategies that work, for themselves and work for others, but work especially for people, with hearing loss.
So Russ, I'll answer the first question, and then I'll turn it to Antoinette to answer part two. So your question and talk about the anxiety and the withdrawal. Yes, there's been a lot of research for many years. That's the whole reason for, let's say, the scales, the hearing handicap came from people withdrawing the understanding to understand the impact, where people withdraw from social situations. And most recently, a lot of the focus has to do with listening effort, the fatigue, the exhaustion that goes with that. And that's one area that we're looking at, but there's a lot of other research. And one thing that you did in running the group in DC, Scott Bally, who's written the book on speech reading and is a wonderful colleague of mine, we put together an article about using humor in rehab. And then you ran one session with one of your groups having to do with misunderstandings. Humor is, when we can find it in life, that is, to me, what balances out the tough, difficult things, as we all have, So a combination of understanding, there is research about anxiety and about fatigue, the effort it takes and how it impacts, makes things much harder, and results in withdrawal from situations, you're just avoiding it, as well as what you've experienced and tried with one at your chapter at one point, about the role of humor, the humor of misunderstandings, not that hearing loss is that way. And now let Antoinette respond to your other
Can I
question.
make a response? Oops.
Oh, wait, Diane wants to add.
I was just going to say, I agree with the comment that there needs to be training for people who don't have a hearing loss, but are hanging around people with hearing losses. And I think it's really takes education and kind of therapy to learn to do things you're not used to doing, for all of us. But most places, particularly in homes with family who love each other and want to communicate with each other, the person who doesn't have the hearing loss keeps forgetting. They just keep forgetting to do the things they should do. And so it really falls to you to teach them what they need to do to make it possible to have a flowing conversation. So that's a difficult thing, and I really think you're correct. And it takes time working on it. I have a husband who has hearing loss, and I'm guilty of the same thing. Lots of times I don't remember, wait a minute, I'm standing at the stove cooking with my back to him and he's not answering me. And I'm saying, why aren't you answering me? Because I don't hear you, right? So I think there's a good point to be made there.
Yeah, I'm sorry, I didn't mean to cut you off. I totally agree, Russell. I like Diane, my husband was diagnosed and got hearing aids 10 years ago. And it was a huge struggle for me as a person who works in this field to make those adjustments, that I can't just yell across the bar in the kitchen anymore and say something and he's still looking directly ahead, and it's frustrating. But I think what happens is that people get into patterns of communication, particularly when you've been, daughters and husbands and wives and siblings, et cetera. And it's very difficult to break from those habits. Often in our practice, we do work with the family. I mean, if there's a significant other, I've actually even talked with people's coworkers from work, because they have, said, they really want them to be able to know about the types of things that they can do in order to make this situation a little bit more appropriate for the person with the hearing loss. So I totally agree with you that, it's a struggle, but we're perfectly willing to sort of sit down and say, yes, you need to use that that process from clear speech. Take a pause at the end of two words, take another pause at the appropriate space in that sentence. Ask that person, did you understand everything I said? So there are back and forth strategies that need to be addressed for sure. You're definitely on target.
Thank you.
Russ, I'll add this. Many times they can't hear it, even in the family. I had a similar situation with my father being hearing impaired and my mother talking from the kitchen sink, like you said, Diane. And sometimes they won't hear it in the that way. You could have your daughter reach us. They need, many times, the significant others, they have some of the same feelings of frustration, exhaustion, and they need to be heard as well and validated. And what can we do to make it easier for you, for them to remember? What for your dynamic, let's say, with your daughter? And yes, you could have her reach me if she'd be willing. And we've done group situations. Right now we're talking about one-on-one, but we've done with significant others there. And it's often, it's not hearing loss in isolation. It's hearing loss in the context with family members too.
As part of the speech reading and related topics group I used to run at Gallaudet, we offered a specific registration fee for family members because we wanted them to be a part of it and learn the specific strategies and know what the other person was experiencing. So that, again, that's just something that, yeah, we definitely need to offer.
I don't see any other hands raised. Lisa, you want to wind up the session here? Although Sarah just raised her hands, I don't want to impose too much on our captioner. If you can make it a short question, Sarah.
Sure, I'll try, if that's all right, Kate. Sorry. So hi, everybody. Just thanks so much for having me, and thanks for having this important discussion. I'm actually a doctorate student in New Jersey. I go to Rutgers University, and so I'm kind of crashing your HLA meeting, so apologies for that. But as I mentioned, this is such important information. But the question I have, I don't think there's an easy answer to it, and it might seem rather obvious for those of us who are hard of hearing and for those of us who do wear hearing aids. But especially in certain environments, in academia, and even before I moved to Jersey, I lived and worked in DC. And so in those sorts of environments where there are a lot of egos and sort of authority figures, it can be very difficult to highlight the fact that, well, I should sit at the table because I have a disability. And so I've really grappled with how to communicate why it's important for me to hear. And even in academia, I've had many discriminatory comments made against me, one of which has been, well, you have hearing aids, so you can hear. Like, why is it important for you to, be sitting in this special place? Or why do you get these sorts of advantages when we don't get them? And so how are, what are just a few sentences that I could say that explain why it's important for me to hear and participate, and why it's important for somebody even with hearing aids to be able to be in certain positions. Like I said, I don't think there's an easy answer, but again, just thanks for your time and this presentation.
Have you gone to let's say a professor in a class and explained it to them so they'll support you if you say something?
I tried, and actually one professor said, well, is it really important for you to hear what your fellow students have to say?
Oh, no, I would never say
So
that.
yeah, I mean, it's been really bad and incredibly frustrating. And I've been really outspoken about my experience, because no other student should really be having to encounter the discrimination and frustrations and challenges that I've encountered. And even beyond that, I understand why people with disabilities avoid academia. And even for myself, I really didn't want to go back to school, but for various reasons, I found myself back at school and in academia. And it's hard to convey how much of a challenge this entire experience has been as somebody with a disability. So yeah, I'm speaking maybe too frankly, and I shouldn't maybe be so outspoken, but certain things really have to change.
Yeah.
So
and I think that's your truth, but it is true, and that's hard. Have you ever advocated by going to what at our university is called, they've got a new name probably, but disability student services, and ask them to make a handout on the subject that comes from them? In other words, you write the handout and ask them if
I know you want to do a lot of back and forth. I would suggest you take it offline so we can get our captioner off. Yeah. I will say this quickly, though, from a public policy position, which is mine, the Americans with Disabilities Act protects you in that situation and says you're entitled to equal communication access. So if they're not providing effective communication, they're in violation of the ADA, and that you should take to your student disability office. But you two should connect so you can talk more, or I'm happy to talk to you later too. But I know Lisa Johnson is a wonderful captioner. She's been on a long time, and we really appreciate her. I don't want to abuse her, the privilege of keeping her a little longer. So Lisa, you want to wrap it up?
Sure. Just thank you again to everyone for coming today. It was a great turnout. I think that's a testament to the speakers and the topic. And thank you, of course, to our presenters. It was so informative. I'm sorry we ran out of time. Maybe we can have you back next year. And again, thank you to Lisa, our captionist. And I'm sorry, I think I answered questions because there are so many Lisas in here, and I kept thinking people were asking me. So sorry about that throughout the meeting. But anyway, thank you, everyone. Have a great rest of the weekend. And if you haven't taken Lisa Hamlin's email, I would copy that down and let her know if you want the handouts. Thanks so much again.
Thank you.
Thank you. It was our pleasure. Thank you.
Yeah.
Thank you.
Bye, everybody.
Get that Lisa person's